Probably the most immediate issue on climate change that we are seeing is along the lines of communicable disease, the uh, increased rates of dengue fever outbreaks. I think that's the most immediate thing that we've seen in terms of climate change. Then the issue of sea level rise is probably something that's in the minds of a lot of Palauans.
And have you made any changes to your health system in response to these increased risks?
Not really. I think traditionally the worldview of Palauans is actually environmentally based. But I think many of us who have been educated in the Western schools have gravitated to more of a kind of a narrow, individualized, sometimes worldview. And so it's been a really challenge for the health sector to try to dismantle that and actually go back to a more wider environmental worldview. If you look at our constitution, it does make reference to a healthful environment. If you look at our mission statement, it does talk about healthful environment. And so environment is something that has been part of our thinking, our worldview, the way we actually talk about our world. And so I think going back to that environmentally based discussion or thinking is something that we need to do in the next few years.
Um, we've spent the last week or so talking with some people in the community, and we've heard some conversation about food security issues, or the changing from the sort of traditional type foods that may be threatened by the saltwater rise and changing, fish migrations and that sort of things, to a more Western sort of diet. Do you see any health impacts of that trend?
Yeah, for us, food is something more than just nutrition. For us, food means family. We actually gravitate to those who actually feed us. It's not those who gave birth to us. And so adoption for us is very common, and we tend to think of people who are close to us based on those who feed us rather than those who biologically gave birth to us sometimes. And so food in essence is not just an issue of nutrition or sustainability, it's actually a social issue. And in terms of food, there's a whole lot of factors, and I think if we're going to talk about food security, we need to look at the snapshot of where we are and what climate change might do. Um, all along, there's been a whole lot of political situations that have led to the change in how we consume food and what kind of food we're consuming. Right now, there's a lot of influence on Western diet or high-calorie processed food in Palau, which is not necessarily a product of climate change. It's a product of our colonial or political systems. Now, because we're dependent on that, it becomes exacerbated when the issues of climate change and threatening of our local foods, because if we're so dependent on imports, and someday we forget about the local food production, and it gets damaged by climate change, then the resilience that we talk about in terms of food security is no longer there. We cannot fall back to something that we understood or that we could use. So I think there are some issues with regards to food security and climate change and the modern diet that Palauans have adopted. Yeah.
Can you tell us anything about the role of any sort of traditional healing or local use of medicinal plants? Is that
Mhm.
relatively common?
It's very common. I guess as a minister of health, one of the dilemma that I've struggled with is what is the alternative medicine? When I read literatures and that actually call our traditional healing alternative healing, is that really rightly so? And who said? I think we as Palauans need to think of our traditional healing as the healing for us, and actually Western medicine or Eastern medicine that's coming in are the alternative healing. See, healing for us is not medicine. It's not. It's not medically putting medicines on things. For us, food is medicine. For us, social network is uh, medicine or health. For us, sometimes um, political arrangements and harmony is actually health. And so when we begin to build a narrow definition of health as or medicine as physical, then we lose some of the flavor on what we traditionally think as health or healing. And I think for us, healing is much more than just the hospitals and stuff. And so I hope someday we will be brave enough to say that our traditional healing is the actual healing. The other stuff that's coming in are actually alternative.
I have another question that's unrelated to what we were just talking about a little bit, but one of the expected consequences of climate change if it continues, of course, is this issue about increased extreme weather events, so long-term heat wave and drought, or heavy, rain, flooding, landslides, that sorts of things. But in addition, the sea level rise that we've heard from several people already that they're experiencing this, and we were looking at issues of exposure and vulnerability and so forth, and but we also know that this hospital is very very close to the ocean. Have there been any difficulties with that? Any threats to the hospital that anyone's noticed?
Uh, Interestingly enough, I think if you look at Palawan's burial grounds, they're not by the sea. Interestingly enough, and probably has something to do with closeness to heaven and all of those other issues. But the modern life actually put um, convenience and scenery and all of that modern ways of looking at issues, and that's why we place the hospital thing here, because it's aesthetically good, I guess, or it looks, you have better views, all of that. But what it has done is actually place the hospital in a very vulnerable position. First of all, it's connected by one causeway, that if the earthquake were to happen or the tidal waves and it gets washed out, there's no access to the general population. It is by the water, and a tidal surge will overtake the ward and all the healthcare workers that might be working. And by the way, it's just not the hospital. The hospital, what it did was became a magnet to other health entities. So, close to us are private clinics who will also be taken out in case, let's say, a tsunami should arrive. And so the hospital, as it is right now, is in a very vulnerable place, and it's been studied. So we have initiated a project called Project Uphill. We named it so that we begin the process of thinking on how we can actually move the hospital to higher grounds and perhaps a more secure place. So.
And do you have any thoughts or concerns ever about some of the population that are on some of the outer islands that are a little bit farther away, as far as the climate change issues or even extreme weather events, and how do they access medical care in a disaster of that sort?
In terms of the outer lying islands and some of our atolls, for example, in Kayang, it's very interesting. But people from Kayang, for centuries, have always believed that they have the power to actually turn the tide away. So for whatever reason, they've never been inundated with water. And I think for us Palauans, that is the essence of our survival, is that we, to some extent, accept certain realities, and that maybe death is not necessarily a foreign issue in the way we think about the life cycle. And for us, time is not linear, it's circular. And so we believe that if that is lost, then someday something new will come up. And I think in thinking so, many of the people who live in these low-lying islands outside of Palau have learned to build their resilience about that circular thinking of time, and that they are happy with it. Now, when it comes to science, there might something to be said about what science is saying. Can we negotiate what they believe and what science is telling? And can we convince them that there are things that might have to be planned in order for them to survive? I think there is room for that, and I think a lot of those people are actually listening. So I think that's not something that we necessarily have lost.
So what do you consider to be the, if there are constraints and obstacles in addressing health issues to climate change in Palau, what would those be?
Probably the biggest constraint is discoordination. It's been said that the biggest threat to health in the Pacific is discoordination. And while we are not necessarily a very discoordinated society, we're very coordinated in some sense. In some way, the discoordination happens between what we think as a modern system and traditional system. And I can tell you the traditional system is very well coordinated. They know what the hierarchy is and when to speak and when to behave but when it comes to the modern, it's a little bit more tricky, and then it's even trickier to actually merge these two systems. So if I were to really look at resilience, I would like to go to the old system, where when something happens, there's only one person, happens to be the chief, that says, look, we're going to do this, and everybody follows. So I think it's this coordination is probably the biggest threat to health, or these issues of climate change.
So how informed do you consider the general public of Palau to be on issues of climate change in Palau?
They're not fairly well informed in the modern sense, but I think they're fairly informed in the local sense. I just know my dad. Let me use my dad for example. My dad always knew that when the moon is at the horizon, the tide is high, and he never failed. Now he doesn't understand gravitational pulls and all of that. He just knew that when the moon is at the horizon, the tide is high. When the moon is noon, the tide is low. So Palauans are like that in a way. They've observed a lot of these things, and they've made rules, and their lives revolve around some of these rules. Some of those rules are now shaken, and now they're beginning to question, why are the things that we used to rely on, why are they changing? They don't know the scientific reasons, they just know that something has changed. And I think that is the best information that Palauans have. Now the trick would be to take the science and explain why what they feel is not inconsistent with what we see in science with science.
So even in this, in the sort of traditional system and these observations, have you seen any sort of ways that they're beginning to adapt to some of the changes that they're observing, even within the traditional understanding?
Yeah, in some sense they have. We are beginning to look at more resistant crops. We never thought that kangkung or the watercress or whatever they're called, we never thought they could actually grow on farms. We always thought they were a swamp plant. But now a lot of people are planting kangkung on the garden. They're beginning to plant taro in the garden rather than in the swamp. So I think there's some changes that has occurred in looking at some of this risk. Whether that's going to be something that's more coordinated, I'm not really sure. I just know that people have had to adjust to the changes that they've seen in their daily lives. I mean, there are people who are now very careful not to build their house along the seawater because they've seen the sea level rise into some houses in Palau. So a lot of houses are now being built on the hill rather than on the seawater along Bubble Dog.
So can you describe a little bit about sort of the emergency response or planning for disasters that has developed in Palau?
There have been a lot of disasters. There have been natural disasters. There have been political disasters, and it's very funny because in some of the political disasters, and I call them disasters because they really do qualify as disasters, the people who were called to actually take care of that disaster were traditional leaders. They were not elected leaders. When it came to natural disasters and let's say the bridge falling, then the government really stepped in, but they stepped in with very close consultation with traditional leaders in the communities. And I think at the end of the day, the government would respond way much later than traditional leaders or traditional leadership within the communities. I think they're not going to wait for government. They will just do it as a community project or community issue. So,
So that's a strength for
right. I think that
for
is a
Palau.
strength. Yeah, that is a strength.
I think that's all I have here, and I don't know if there's anything additional you want to say or talk about as far as your sort of general experience or thoughts about how climate change may or may not affect Palau, for this generation or following generations, maybe even 50, 100 years out.
I think in Palau we're a little bit lucky because we have volcanic islands, and so that if the sea level were to rise, I think we would lose lands, but I think there will still be possibilities of generations to come to live in Palau. But what's really sad is that we know it's coming, but we seem to have very little to change it. And I guess the message to the rest of the world who, in their convenience, may not be very aware, we ask that they take time to think about the sacredness of all of us who were given all of this heritage for a purpose. And so in changing that mindset, and as you can see on the wall, and I hope you take pictures, Palau is slowly moving into what we call an integrated environmental model in how we look at health. And we no longer just look at health in the physical sense. We actually look at health in the social, mental, behavioral, physical, and probably much more so spiritually and sacredness. Because we actually believe that we were put on earth for a purpose, and our loss or our not being around in this global village would mean something of a great loss to that to that heritage. And so, while we have no direct control to all of these bad gases that smart people talk about, we definitely hope that our voice will be heard. That at the end of the day, we are no less sacred than those who actually produce those CO2, those carbon dioxide. So probably that's it. That is the message that we want to get out there. As you know, I serve right now as the president of the Pacific Island Health Officers Association, and the 48th meeting in American Samoa, we passed a declaration of a state of health emergency on chronic illness like high blood pressure, diabetes, cardiovascular, heart disease, or asthma, or others. And the reason for that is in the Pacific, not just Palau, but the rest of the Pacific, these diseases are of an epidemic or proportions. But the world mobilizes very differently. They mobilize on the threat to those who have resources. And if the threat is such that those who have resources feel that their lives are being threatened, then resources are mobilized. And so, based on the realities of those, we are actually arguing that let's change that the resources ought to be mobilized even when those who have resources are not necessarily threatened, and one of which is chronic illnesses. Because the vulnerable population sometimes do not have the mechanism to actually rise above those vulnerabilities. It's actually based on those who have resources, who on their own merit look at vulnerabilities and actually address it. And so the state of health emergency on chronic illnesses is exactly saying that we understand that we have the vulnerabilities. Is anybody listening? Can we mobilize resources? Because some of these vulnerabilities are not necessarily of our own. Turn on the television. You can see the kind of silent, and I've called it imperialism on food, on language, on culture, that has overtaken our lives to the point where our world view is beginning to adopt those things that are not necessarily good for us. Can we mobilize ourselves and our resources to address it so that we do not in the future become burden to the rest of those who have? And I think that was the purpose of that declaration, is to hopefully make noise in this generation so that we can protect the generations to come.
Do I have time for one last deferred question?
No, I'm good. Anyway,
Okay.
yeah.
So, back to talking about climate change just a little, could you just tell us what you consider to be sort of the greatest vulnerability perhaps that Palauans have, and then the greatest strength?
Yeah, to me the greatest vulnerability in Palau is actually not the children, not the women, and not the elderly. That is not the greatest vulnerability. It's actually those people who are well, or so-called non-vulnerable population. To me, that is the biggest vulnerability. Because unless we adopt a health model so that we protect the healthy ones, then the vulnerable will also suffer. Now, the reason I say it's not the children, it's not the women, and it's not the elderly, is because the biggest vulnerable population is the mentality of the healthy ones. They ought to own these people. If they could just turn that and own, then that will solve a lot of issues. And I know that the debate is always that the women and the children and the elderly are vulnerable. There's no argument about that. But they only become vulnerable when the healthy ones are not looking after them. So the biggest vulnerable population is, in my mind, is the healthy ones, almost like the airplane. Put on your mask first, and then help the next one. Because if you don't, all of you are going to going to die. The biggest strength that I think we have is that we have, first of all, I think as an ethnic group, we have a very strong tradition still that governs our life. That's one. That's what I think is one of our strengths. But actually, the other strength is the ability to open discussions with uh, friends all over the world who are willing to come in and actually fill the gaps of where we are short. I think we cannot discredit that, because a population of 20,000 people will never, ever, ever, ever in their lifetime become self-sustained, ever. And I think the ability to mobilize resources and give and take and negotiate some of these issues is one of our strengths. And to some extent, we've done a very good job at that. So.
The only other last question, each question goes anywhere, I guess. When you're talking about this population of the healthy and changing their mentality, how do we do that, or how does that happen in Palau?
It's a force that the nuclearization of a family, and the more we become based on cash economy, the more we gravitate away from. We are a clan society. We are a kind of pluralistic society. We take care of our own, and so the children are children of the village or the community. The elderlies are elderlies of the clan or the community. But adopting the cash economy and moving into modernity and becoming a nuclear family, we're slowly moving away from that ideal. And that's why I say it's vulnerable. Because as we move toward a more nuclear family, the more we neglect those who are vulnerable. And that's why I say the biggest threat is actually this issue of migration to modernity. For example, in the old days, when we didn't have freezers, a fisherman would go fishing and then would share his catch with his sisters and with his relatives. Now that we have freezers, we put them in freezers and we never get to see them. Mm. So that's just a very simple example of what I think is the biggest threat, that it's really the healthy ones that are going to have to pause and realize that we cannot just move on without having to reflect on whether what we're losing is bad, because I don't think it's bad. I think it's actually good.